This conference will now be recorded.
Good morning, everybody. Welcome to today's RHA webinar. Thank you for joining us once again. As usual, everyone is muted on this webinar. If you do have any questions at all through the duration of the webinar, please do pop them in the chat box. That will remain open throughout the course of the webinar and once it closes at the end. A couple of in-house pieces first. If you'd like to give us a follow on our social media channels, we have Twitter at RHA News and Road Haulage Association on Facebook. Lots of detail on there at the moment, gearing up for National Lorry Week, the campaign that has started. We do actually think it's a really important campaign to display not only how important the lorry is, but everything around the lorry, you know, the roles, warehousing, logistics, the list goes on. So it's really something we're passionate about and want to get member and industry involvement. So do look out on there for all things National Lorry Week. We also have our Roadway Live app that's available on Android and Apple stores, all latest industry updates and news, including RHA future events and webinars. As I previously mentioned, everybody has been muted. The webinar is recorded, so if you do miss anything, it will be posted onto our website at a later time. Today's webinar is Driver Health and Wellbeing. This is brought to you by Simon Priest, who is one of our area managers in the Midlands and Western region. So what I'm going to do is I'm going to pass over to Darren, who's going to play the recording of this webinar. Darren, over to you.
Thank you. Hope you enjoy the webinar. As you can see, I'm Simon Priest. I'm the area manager for the West Midlands, Staffordshire, Shropshire and Mid Wales. Welcome to you all. So today we're going to be talking about driver health and wellbeing and what are your responsibilities. I've broken it down into 4 sections. So legal aspects and health and safety legislation is often seen as a hindrance rather than an enabler. It is set out to protect people from getting harmed whilst in the work environment, and therefore it should be embraced. The financial aspects, so what are the costs associated with driver ill health? And we'll look at the potential cost benefits to a proactive approach. The social aspect, how do customers, suppliers, public perceive your business? Is it positive? Is it what you want to hear? How are you making a difference to the well-being of your staff? And finally, the ethical side of it. What are you doing to help driver health and well-being? And what can you do to help the situation? So, the legislative side, as I think probably most of you know, the Health and Safety at Work Act is the main source of legislation. I think the COVID crisis has made us focus on the health aspect of the legislation recently. So we're going to focus on that today, but I will draw on to the safety side at certain points. A lot of people talk about the duty of care, or sections 2 and 3 of the Health and Safety at Work Act. Actually, what does it really mean? Well, it advises employers that they need to protect and provide welfare to employees and visitors, must have a reasonably practicable approach, and must apply control risks that could arise at work. They have a duty to assess the risks, and a duty to provide information, instruction, supervision and training to avoid harm. Must also consult with trade unions and employees. Also have to remember section 7 and the general duties of employees at work. And employees need to look after themselves and those of others who may be affected by their actions. Must also cooperate with businesses and the legal requirements in relation to the Health and Safety at Work Act. Just a reminder that if a breach does occur, then you can receive heavy fines, possible imprisonment if it leads to a fatality. Section 2 and 3 is used in the majority of these cases where this sadly happens. So what do you need to consider? First and foremost, site plan, your office, yard, building. As a minimum, consider moving vehicles, pedestrians, fire hazards, and consider escape plans. The escape plans are especially important to consider if you're making any changes relating to social distancing measures. Risk assessments must be suitable, sufficient, signed and dated. And I think we also need to remember about equipment, Lola, forklift trucks, machinery. Has it been used recently? Give it a check over, ensure it's safe working order before it's used. Again, this is relative to the current situation. Information, supervision, instruction and training. Evidence you have carried out the instructions. Again, if you can get people to sign and date, these are key communicating documents. Two-way communications is very important for wellbeing issues and employee support. Please check in with the staff, receive their feedback. Maybe you can stop issues escalating. Health checks are available, occupational health checks if employees have been off for a period of time. Make sure they're fit and ready to work mentally and physically. We all know that drivers have to have medicals every 5 years, but if they have been off for a period of time, again, how are they coping? Stress of returning to work, especially after a long absence. We know about eyesight tests, and they're a good indicator of early issues, and this is one of the many questions on an RHA audit. So please make sure you're doing those with your drivers. And lone workers, what measures have you got in place? Lone workers being obviously drivers, maybe area managers like myself. How are they for people keeping in touch with the staff, making sure they're well, safe? Also consider the security concerns. The German Christmas market a few years ago is a key indicator for that. Going back to COVID, I'm sure you all know about the social distancing, 2 meters. We're all pretty well versed in it now. But in relation to your business, consider especially where drivers can congregate. Driver areas, garages, near vehicles. We know drivers like to have a chat. So what can you do to mitigate that? Be aware of it. Consider your equipment, door handles, vehicles, computers, welfare facilities. Have you got good ventilation? The list goes on. Clearly, most of all, wash your hands. There's more information relating to COVID, which I'm going to direct you to from this page. You can see the links below. If you do need them being sent to you later, we can provide that. There is 8 documents being produced which are specific. There's one for vehicles, there's one for warehouse, factory and offices, another one for homes, restaurants and takeaways, laboratories, construction sites and shops. And there's an 8-page document which you'll see on the left-hand side of your screen, working safely during the coronavirus outbreak, a short guide. That is well worth a read and will give you some good indicators of what you need to do in the current situation. Just a reminder that HSE will consider to take action, and this will be from improving control measures to enforcement notices. So you really need to be considering what you're doing in the current situation. If you do need any further support, we have got a health and safety service. Speak to us for more details. just to make sure you meet the current requirements. There's also a link there to how to carry out a risk assessment. And if you aren't comfortable with that, again, please speak to us and we'll provide this information that you need and put you into that support service that we offer. On to the costs of mental health. So sickness and absence, cost to the UK economy, £77 billion. By comparison, our industry is worth 124 billion. Just shows you how much of an issue it really is. And as you can see, there is, it's worth billions. Productivity, costs, sickness, absence, and staff turnover. Mental health related absence is equated to 15.8 million sick days, and that was in 2018. If that's the cost of the country, what is the cost to your business? If a driver does not turn up for work, do you think about the related costs? So, as I said, about driver absence, unexpected occurrence. So a driver calls in sick, you need to source alternative ways of covering that work. Time taken is a cost and it creates stress for all really. If you have to use an agency driver, it is likely they will not be as productive, they will require induction, checking of documentation, additional PPE, and need to ensure they are fit to drive. More lost time and pressure for everyone concerned. Maybe you need to utilise your own staff. They still may not be familiar with that contract or route the driver takes, and therefore there are potentially more issues and uncertainty, concern and anxiety caused. It's highly probable that the routes taken will be longer and, in essence, more time. The driver may not be familiar with sites, so it takes longer to find. Driving style may vary and create more fuel costs. What do you need to do to cover the work? Is it contract specific, specialised knowledge? Will you let the customer down? All things to consider. More importantly, will the employee be off for a long period and therefore additional recruitment costs will be added? It's a stressful scenario for everyone, one that happens in our industry every day. Can we reduce the pressure and be more proactive? So looking at a proactive approach, can we consider this as a cost saving? Was it really an unexpected occurrence? Did you see any signs? I've been quiet lately, argumentative, distant, agitated, depressed, and there's quite a few more things that you might need that you can look out for there. Is there a trend? Do we always call in sick? If it's a certain run or type of work, is it always on the same day? Has there been any noticeable difference in their behaviour? Are we requesting a change to a work pattern? Are there more frequent requests for time away from work? Is something at home changed that you're aware of? Doctors, concerns, issues with family matters, they're not talking to you. All of these are indicators where you can support them, stop the absence happening, discuss it with them, and help them through any issues they're having. Onto the corporate social responsibility side. And do you get good reviews for your business? Do you have positive feedback? Do you and your staff have good relations with suppliers, customers and other staff? Obviously, people talk, and this could make you more attractive to potential employees. It may also improve the standard and number of candidates that are interested in working for you. We know today young people look at websites and what the corporate social views of the company are. Do you support the local community? If you do, then staff will feel more in tune with the culture. Create a good feel-good factor around the business and create a positive culture for you all to benefit. People wanting to work for you will likely give a sense of pride and will already have the same ethics as the other employees. More likely to achieve more and be a team player and contribute to a positive atmosphere. Chances are there will be a good, reliable staff member. So on to employee feedback. What do your employees say about how they feel about working for you? Consider the effects. Are they positive or are they negative? Are they good or bad? If they're bad, why? What's changed? Can you step in, resolve the issues, nip it at the bud early, provide the support? But do you live up to the expectations? Do you promise an open door approach? Yet the door is never open. What are your employees saying? What is the atmosphere like? What is customer service like? Unhappy staff will likely give over a negative feeling, tone and response. A good leader will help staff feel valued, feel open to discuss issues, ensuring a positive atmosphere and good working environment exists. Lead from the front. Some statistics for the industry. We know 1 in 4 people experience mental health problems each year in the UK. This is likely to be higher in our sector as it's more male dominated and there are many lone workers. 76% of all suicides are by men, and this is the most common cause of death under 45. 70% of employees don't feel able to speak candidly about mental health concerns. If you're a driver, who do you talk to? We know the trades have learned not to talk, a bit brave, bravado, I'm okay, but are they really? How do you communicate with your drivers? Currently, we know the average age of a driver is approximately 57 years old. We know that they're more likely to have non-visible health issues, diabetes, obesity, etc. We also know they're more likely to catch a coronavirus, hence why it's important to carry out that COVID risk assessment. Consider whether they should be self-isolated. We know there's many issues out there relating to the industry, and many are not caused by the industry. Lack of welfare facilities have been well documented in the current situation, and you've probably seen the RHA has been working to improve it, and thankfully people have listened and we've been able to support the drivers in their area of need. Irregular meal times, sadly, drivers are up and down the country 24 hours a day. Irregular meal times does not help with the obesity issues, and drivers tend to grab what they can, and that's most likely not a healthy option. Lack of good healthy food options, well, that's limited for them. Most haven't got fridges in the cabs and tend to have a cool box. So keeping fresh food is difficult. And again, they'll tend to go for the easy options. Lack of exercise. Clearly, driving long distances creates issues for drivers with back and knee problems. Difficult to stretch out and avoid long-term issues. I know trucks nowadays are far more improved than what they were back in my day, but still it's an issue. So when they do park up for a night or go home, what do? Poor opportunities to exercise at the moment. We know that there's efforts going on with that. Part of the barrier for younger people coming in, they have a healthier mindset, and the gym is usually a meeting place for them nowadays. It's difficult for drivers to access gyms for obvious reasons. We know that there's some changes on that with the motorway service areas, which is good to see. And with the coronavirus, many people have looked at different ways of how they can exercise in their homes. Maybe we can consider some of them as an option to explore further. Encourage drivers to take a walk if they feel safe to do so on an evening. Clearly to say, if you do speak to them, make sure that they're not putting themselves at further risk in whatever you're doing. The stress of the roads, traffic, time constraints, and the regulations which drivers complain about daily, but need to be done, all add to the stress. What considerations have you given to helping your staff seek healthy alternatives and guidance to these? Maybe provide some healthy food leaflets or information on light exercise activities can be carried out. Ensure from a credible source, and as I said earlier, will not cause illness, injury or harm. Motorway service areas are already acknowledging the issue. We've been speaking with a number of companies recently, and you know, thankfully they're supporting what we're trying to do, and they're providing some healthy food options. There's some gyms available, so we are getting there, and that's great to see. Transport managers, business owners and directors, I know this is around driver health and wellbeing. I wanted to just touch on this side of it as well. Transport manager job is highly pressurised, demands are high. You've got customers, directors, drivers all to manage, and juggling balls is a very, very difficult job, and I know from personal experience. Regulation and compliance matters need to be controlled, and the consequences are high if they're not. Adding the profitability concerns, you can see there's potential for health issues, not just for a transport manager, but the business owner, especially in the climate today, and directors. How can you ease the burden for your staff? What would you do if your nominated transport manager went off on long-term sick? Do you have a backup plan? Even better, what support are you providing them? Are you looking after you? If you can resonate with this, take stock, ask for help, put a plan in place to ensure you can proactively manage the business and ease that pressure. So how can you help? Well, as you can see on the screen, there's a number of things there. Are people you know, do they have extreme feelings of high or low mood? Are they affected by alcohol, substance abuse? Are they becoming socially withdrawn? You can see all of those on there. Do you know anyone that might fit into one of those categories? What can you do to help? Have you got anyone trained on site to help? Do you know where to get that help and support that you might need to give them? Maybe you need to consider a mental health first aider that can see the signs, ensuring issues do not escalate, so they can support the person and help get the need that they require. Onto the ethical side of it now. We all talk about the work family. We spend a lot of time at work, either in the same department, business, and spend more time with them than our own families. We can consider colleagues as friends, and most of us do. If the environment does not contribute to a healthy place to be, it's highly likely you will face a higher absence rate. Team ethics. They say teamwork makes the dream work. Evidence suggests this is true. We tend to get more done, be more creative, and support each other more. Creating a positive team ethic will also help reduce sickness and absence levels. It will be more noticeable if someone is feeling low, and the team will support them. Dynamics. If a positive influence on the team leaves or is a change to the dynamics, uncertainty and anxiety can creep in. They may be leaving for better opportunities. The staff left still may have concerns on how they cope or if the new person fits into the team. Consider how your team can be effective. Ease their fears as early and as best as you can. Naturally, we tend to care for those we respect and enjoy company with. Getting the dynamics right will ensure the team provide the support they need for each other, helping ease the burden on you. Be a leader. Don't do it because you feel you have to. Don't think it's just a tick box exercise, because it will not work. Remember, it's not what you do, it's why you do it that matters. This is the final slide, and in summary, a good employer providing the leadership for their teams and the support required will have the following positive impacts. We know it will help improve the driver shortage. It will keep drivers healthier and people longer in work. and it reduces that pressure on the NHS that we've heard all about over the last few months. Retains the skills of the people. Happy people will likely stay. It's not all about the pay rise. It improves the culture of the business and potentially reduces incidents, and you'll have less damage. You'll get better productivity. It reduces costs such as insurance, recruitment and employment costs. But most importantly, it will improve the health and well-being of your employees. Speak to the RHA for further info. We can direct you to the resources if you need further guidance, and I'm more than happy to take any calls or messages on that. Please feel free to get in touch with us. So just to finish off, please play your part and let's improve the health, well-being and culture of our industry. It costs nothing to be nice, and it's nice that it costs nothing. But before I go, I want to leave you with a challenge. Go make a difference today. Start a conversation with someone in your workplace. Maybe someone you don't talk to often. Could be a telephone call. Obviously, we have to consider social distancing. It might just make a difference. So thank you for listening today. I hope you've enjoyed it. Stay safe all, and remember to always keep smiling. I hope you
Okay, great webinar there from Simon. Really, really important subject. I'm sure you'll all agree. It sort of leads us into obviously what our next webinar to Thursday. That's infringement management from Tom Cornwall, who again is another area manager for the RHA in the southern and eastern region. If you are interested in that webinar, please do book on our website. So just go to rha.uk.net. You'll find all the information there with regards to booking on. Concludes all for today's webinar. If you do have any questions, I'll keep the chat box open for the next few minutes or so until everyone has left the webinar. Anything in specifics on the webinar that Simon just presented there. Thank you all and have a nice day. Cheers.